I'd like to start with just some of the language that we use with respect to the work that we're doing. So this project is around de-identification of electronic medical record data. And so when we think about masking this, what does that mean? It means that we could either remove or replace personal identifiers so that we can't establish a link between an individual person and their data. But we can still, in the de-identified data, we might still have an encrypted patient identifier in the administrative health data sets in many of the provinces that we're thinking about so that we could relink a patient with his or her data set. And that's different from the anonymization process, where anonymization is all about the removal of the link between the individual and their health data so that it would be impossible to reestablish that link. But if we had appropriate approvals, we could actually re-identify from a de-identified record, but that's not the case if we're actually going to anonymize that record. And for de-identification, well, we could start at the very basics in terms of a manual approach to de-identify. If we're working with structured data where we've got columns that contain information that has identifiers about individuals, that would be a fairly simple process because we could just get rid of those columns. But when we're talking about unstructured data, that's more difficult. There's a block of text, for example. We've got to move through the data and be able to remove any identifiers from the data. And if we were doing that in a manual process, we could have clinical experts or others who are really familiar with the data in order to be able to do this. We can understand that that would be a very costly process and a time-consuming process. And it's been estimated that for the volumes of unstructured data that might exist in repositories across Canada or that potentially might be made available to repositories, because at this point, some repositories don't even have access to unstructured data, that in order to de-identify, it would be an extremely time-consuming process. And most likely it would be unreliable in that we would be relying on clinical experts who might not be trained to the same standards in each of the jurisdictions. So there may be heterogeneity in the training and the types of individuals who might be available to do this work. And that might change over time as well. So there's an advantage to looking at automated approaches that can be used for de-identification of unstructured data. And so certainly we could use something that's very much a heuristic approach, or it's some kind of pattern-based system where we develop lists, manually constructed lists of words. We could rely on dictionaries, or we could use regular expressions or some kind of heuristic, in other words, some kind of rules to remove occurrences of personal health information. And certainly there's been a lot of work, this idea of de-identifying unstructured text data is certainly not new. It extends back many years. And so a lot of the first work that was done was using these kinds of systems. But increasingly, there's an interest in using statistical or machine learning based methods where we're using some sort of annotated training set of examples, and we can search for patterns in the data. This can be done using statistical methodologies or machine learning methodologies, looking for specific features and how to identify personal identifying information from the data itself. And so that's what we're really interested in doing. And the advantages should be apparent in that we could reduce the cost and the time that's required to do this if we can use some sort of a statistical or machine learning approach. We can understand kind of how learning is done within the system so that we can identify where there may be challenges in terms of the accuracy of this approach, and that can be helpful. And so this is beneficial when we think about HDRN Canada and being able to use automated approaches, and particularly moving into the machine learning environment approach, that there would be a lot of advantages in terms of efficiency and also being able to deal with heterogeneous types of unstructured text data should be an advantage for us. So let's just think about an example. If we're using this kind of a heuristic approach or some lexical or pattern-based approach where we would be scanning that free text information. So there might be discharge summaries, there might be reports that come with an X-ray, for example, or other kinds of notes that a doctor might take during a visit with a patient. And this could be done line by line. And taking the text into individual words or phrases. And we can have personal identifying information, or we could have personal health information, and we could identify that by using some dictionary-based lookups and pattern matching using regular expressions. And then every time we came across an instance of this kind of information, we could tag it and identify its category or type. And then what could be done with that? Well, we could replace that information with something else. It might be that we want to use, for example, a generic name so that we know that a name existed there. We might want to completely redact that information so that it was removed completely. We need to think about ultimately about the purpose of what we want to do with the data in order to be able to move forward. But this is the approach that we would take. And when we talk about personal identifying information and personal health identifying information, we should distinguish those two things. Most of what we're focused on with the MASK project is around name and contact information. That's most of what we see in the electronic medical records that we're working with. But there might be other information such as age, sex, sexual orientation, might be around marital status or family status. Then we can also think about personal health identifying information that might exist. And it might be around an individual's health history, what health care is provided, payment to individuals. And this is where we might also have real personal health numbers or other identifying numbers that are in the data. And then there could be a variety of other kinds of health information that might be identifiable. And when we think about sometimes rare diseases too, that can be a challenge for us in terms of this personal health identifying information because it might eventually lead back to the individual. If we're dealing with a small province and very few instances of some kind of rare disease, that might be a challenge as well. So we might need to think about masking that kind of information. So there's you can get a sense of the complexity of the kinds of information that we might have to deal with in an unstructured text format and the diversity of information that might need to be masked. But at the same time, we should get back to kind of what are the roots or the heart of this project. It's being able to increase the diversity of data that are available in our data repositories across the provinces and territories. And certainly in other countries, the number of projects that use electronic medical record data and sift through these unstructured text blocks that are available to find out more information about individuals has proven to be advantageous. For example, there might be information about an individual's health history in unstructured text data. And we know that in general, across the provinces, when we think about the administrative data, that health history information does not exist in the structured fields. That could be advantageous as we think about building predictive models for who's likely to develop a particular disease. And that's happened in other jurisdictions where a variety of kinds of information, including health history, can aid in building precise predictive models. And so having access to this information could be advantageous for the researchers that we work with who are interested in gaining access to these data and taking advantage of it in building models and doing a better job of characterizing the health of populations. Um, there has certainly been work around the different types of models that are available for de-identifying free text information. If you'd like more information on these kinds of models, this is a good paper that actually came from a number of colleagues and actually former students who are based at the University of Manitoba. And so the systematic review is fairly new. I think it was published in 2023, and it talks about the different types of models that are available for this, and also some of the challenges and the advantages of different approaches that one can take to de-identify free text information in electronic medical records and also in other kinds of health information that we might have access to. So I encourage you to have a look at this. All right, in terms of the project that we've been working on in Manitoba, Ontario, and Alberta, so we're looking at building a system that's accurate for identifying and masking identifiable information in the free text fields in electronic medical records or electronic health records data. And in order to do this, we've been working through three objectives. The first one was about building a high quality annotated data set that we could use to train our model. Then to build an AI-based model for de-identification and to do that locally in each of the sites. And then if we could produce a single global model, a federated model, and ensure that it can work well in a variety of kinds of data, then this could be applied across the provinces. And so there's a component, I think, of advocacy for the work that we're doing as well, in saying that if we can do this in 3 provinces, well, we might want to expand our testing of the model to other sites, but we can also take this global model that we've produced and it could be applied in other jurisdictions without having to go through the training process. The development of the annotated data set as a first step is fairly time consuming. And so if we can simply take the global federated model that we've produced and be able to apply it in other provinces, in Nova Scotia, for example, or in British Columbia, to free text information that's available, it would certainly be time saving. There would be some aspect of harmonization to that, and that's important for the Harmonized Data and Tools team as well, to say that we could build something that could be used elsewhere without having to go through the training process. So that's part of our goal in undertaking this project, that it could have benefit in multiple sites. All right, so the steps that align with these objectives then are, first of all, the electronic medical record annotation, and we've used an online tool that's allowed us to be collaborative in terms of our annotation of the text data. There's local training of the de-identification algorithm, where we've worked extensively through each of the sites, training an algorithm on local data that are secure, so the data is not leaving the province that we're working in. And then the last component of this is the federated learning approach, which we're getting closer to finishing off this aspect. And at the end of the talk, I'll describe the work that we're doing there. The sites are working together, though, in order to be able to fine tune and adjust a model. This audience should be very familiar with the process of federated learning. We're not doing any data exchange, but we are dealing with model weights that can be shared across the sites, and they can help us to improve model performance by better understanding the attributes of how the model works in each of the sites, and then drawing on that expertise so that we can fine tune the model to produce something that can be applied to real world data in multiple sites. The data that we're working with in Ontario, we've started with their electronic medical record primary care database that captures visits primary care physicians in secondary and tertiary care. It includes specialist referrals and consultations. There's a variety of information about the patient and the provider, including clinical information that's included. In Manitoba, we've worked with CIPSEN data, the Canadian Primary Care Sentinel Surveillance Network, and in Manitoba, that's MapCRIN. This is free text primary care data. It's important to note that it's already been anonymized. So given that we're working with sensitive health information, we're dealing with kind of different privacy environments in each of the provinces. And so in order to be able to gain access to the data, there was a pre-de-identification process that was required for us in order to be able to use the data. And so we know where names were replaced with something that was not necessarily standard, but the actual names that were included were removed, and there was a replacement process that was involved there. And in Alberta, we've got acute care discharge summaries that came from a cohort that was from Alberta's Tomorrow Project, and it was linked to their Connect Care database, which really encompasses a large variety of hospitals in that province. And so there was already permissions to be able to use these data, and we were capitalizing on that in order to be able to work with the Alberta Tomorrow Project database. So that's the data sources that we're dealing with. And in Ontario, there's been a desire to move beyond just the primary care database. And so there's been additional annotation work that's been going on around other sources of unstructured text data that would include what's available in the laboratory information system, for example. And we could apply the algorithm to these data as well and include that as part of our federated learning environment if we have the time and capacity to do that as the project nears its end. So I'd like to talk a little bit about just that text annotation process that we went through and its importance in terms of being able to build a robust set of information that we could use for this de-identification algorithm that we would eventually train. And so we're including a variety of kinds of information, the patient names, clinic names, there's phone numbers, there's health card numbers, there's different components of the address, and then there's eponyms. So medical terms that could represent a name, but also represent a health condition like Parkinson's disease. And so we spent a lot of time thinking about how we would select notes to make sure that we had enough of these kinds of identifiable information. As well, we also needed to have notes that did not contain identifiable information, so controls for us. And then we wanted to have enough of these eponyms, the disease terms, or also there might be device names. And so there was a very deliberate sampling process that went on and that we thought about carefully in order to represent each of these kinds of information. And then we also had to think about the different kinds of clinical conditions, the different kinds of providers that might also be represented in the data, and how we would ensure that that also different regions of the provinces would be represented in the data as well, because that may represent idiosyncrasies with respect to how the data are captured and recorded, and we wanted to have a diversity of data that were included. So we settled on 10 different personal identifiers of interest in the annotation process, and they're listed here. We didn't take the complete address as an entirety because that was too complex, but we needed to break it down into these different component parts. So a street number or a street name, for example, a post office box number or a postal code was represented in the identifiers that we included. All right, and then moving on to the next part of it, this talks a lot about the process that we're going through at each of the sites in order to train the algorithms that we're working with. So we've aimed for around 2,000 to 2,500 texts that we can split into a training data set and a testing data set. And we're splitting at the document level. But then what we're working with are kind of sections of text within each of these documents. We are training a model, and we're also doing five-fold cross-validation to evaluate the stability of this. We've selected hyperparameters for our model. In other words, the parameters that help us build the training algorithm. And we've been doing some testing as well when we manipulate these elements of the hyperparameters, how they might influence the accuracy of the model. And then we can develop a final training model and evaluate it on a test data set. And then we have a variety of different metrics, which I'll talk a little bit about later on, that we're involved with. This is a fairly resource-intensive process, and I'll talk about some of the challenges toward the end of my presentation that will give you a sense of what we've gone through with this particular project. All right, so what we're taking as input, we've got annotated notes that contain personal identifying information, and we've labeled them. We've got the control notes, and then we've taken these notes and we're really working with sections of text that we'll call text spans. And then we work with those and divide them into training and test data sets at the document level. But we're doing the evaluation at the text span level. So these short pieces, in other words, the sets of characters, is what we're actually working with. And then what we output is a tag for each of the tokens. And if we think about what we're getting, it's not that something is a particular thing, it's a name, for example, but we've got a probability that, for example, Dr. Adams is a name, and it might have a 92% probability that it is a name, a 7% probability that it's an occupation, and maybe a 1% probability that it's not some kind of personal health information. And so we can label what that tag actually is with the highest predicted probabilities. And then that allows us to do some analysis on these probability values to assess where exactly the model uncertainty is arising. Is it with particular types of tags? And what is the algorithm actually thinking that these tags might be? And that can help us if we need to go back in and do some sort of human review, or if we think about as we work with the data custodians in each of the sites, if they want some assurances about where there may be errors or inaccuracies with the AI algorithm that we're using for model de-identification, there will be some transparency about that process, and that might help us in advocating for use of the de-identification tool across the sites. And as I noted, I think that that's an important part of what we do as well, is not to produce one final thing, but to talk about where it works very well, and why it might not work well in particular instances, and how that might change across different kinds of data that we're working with. And so in our notes, we've got this annotation effort. Really, when I think about it, it's concentrated in what would be most important for helping us to train the model that we're working with. And in terms of the model that we're actually working with, it's a bidirectional long and short-term memory model. So this AI model that has a deep learning architecture as well. And what's advantageous here is that it really helps us understand what kind of tag or identifier that we might have by looking at the context. So it's not just about looking at the individual word, but around the context, and that's helpful in terms of producing something that's more accurate. And at this point, we've done our model training in Manitoba and Ontario. We're a bit asynchronous in that Alberta took a bit more time in terms of getting the data approvals in place. And Maybe if anyone from the Alberta site is on, they can talk about where they're at, but have been really working very quickly to do annotation once those approvals came through. So the work that you'll see today focuses on what we've done with Manitoba and Ontario only, but we'll shortly be adding the results from Alberta. Okay, and we've used a variety of metrics to help us evaluate the algorithm performance for de-identification because different evaluation metrics can reveal differences in terms of the performance of the model. So we've got recall and precision and specificity, which are first about estimating the proportion of successful identifications, looking at the proportion of identified elements that truly are personal identifying information. But we also want to say if we've got things that are not personal identifying information, that they're correctly left and we're not redacting them because we don't want to take out things that might be important for future users of the notes in terms of building predictive algorithms, for example. And so it's equally important that we're masking, but that we're not over masking the data. We've also got the F1 score, which is a balance between the precision and recall, and also the F2 score, which is just as a variant of the F1 score that gives a higher weight to recall than to precision. And if you look at the confusion matrix here, so I talked about these predicted probabilities, which give us an indication of what category or that a particular tag should belong in. So we've got our true positives where we've got the annotated data, so we know what truly a tag should be. And then our probability that it is a name, for example, so we can identify the true positives but also the false positives, where we know from our annotated data set what particular category of personal identifying information an entity belongs in, and we know if we're correctly identifying it, as well as where it's a false negative or a true negative, and we shouldn't be redacting in those cases of true negatives. Okay, so a little bit about the data that we've got. And so over the 10,000 notes that we've been working with, you can see how many instances we're finding of names, which are most common, and phone numbers as well are high frequency. Between Manitoba and Ontario, you can see that there are also some differences. So where we had about 13% of types of phone numbers versus 17% in Ontario. And also, health card numbers were less frequent in the Manitoba data, but they were more common in the Ontario data. You can also see that we've got some instances where we have really low frequencies of events of entities that we're aiming to identify that we might not be able to work with. We'd have to do more sampling if we really wanted to be accurate in terms of the algorithm that we're training for these. Okay. And also what we have learned about the data is that the length of the notes are quite a bit different between the Manitoba and the Ontario sites, where they're much longer in Ontario, so they're more dense. They would have more kinds of personal identifying information in them, therefore, and you saw that reflected in the previous slide as well. So, and it could reflect just that Ontario clinicians tend to produce a greater amount of documentation, and that can be the kind of tool that's being used, for example, or how clinicians possibly are even being trained to enter information into the free text fields. Okay, so this next slide talks about the precision estimates. And so the maximum value would be 1 here with lower values indicating lower precision. And I've got both the Manitoba and the Ontario results side by side. And so you can see, first of all, So just with the unit level, there's no Manitoba result because there's too few entities there. And you can see that we have fairly high precision estimates across these different types of personal identifying information. There is some variation between sites. When you look at eponyms, for example, we have slightly higher precision in Manitoba that we have in Ontario. The reverse is true when we look at unit numbers and also when we look at post office box numbers. With names, though, and phone numbers, which are fairly common, and also email addresses, that we have fairly consistent results in terms of precision between the Manitoba and Ontario electronic medical records that we're working with, and the values are very high overall. Similarly, when we're looking at the recall estimates, you can see that we have a number of values which are close to the maximum of 1 here, that there can be some difference between the Manitoba and the Ontario sites. And so here you'll see some difference, for example, in name, where we have slightly higher recall estimates in Ontario than in Manitoba. And also, the reverse is true for eponyms, when we have higher recall estimates in Manitoba than we do in Ontario. We also have some instances where we've got lower estimates for Manitoba with our street numbers. It's quite a bit lower than what we have in Ontario, and also the same with unit numbers. And also there's some difference with the post office box numbers, but very high when we look at postal code, and almost equivalent results between Manitoba and Ontario. We've got the F1 and the F2 scores that are represented here. I've included this slide as a tabular form so you can also see the confidence intervals that are around this. They can be wide in some instances just because we have a low number of instances of entities like the unit number or the street number where they're lower. You can see some consistent results, though, in that for name and phone number, when we've got email address, that we've got fairly high results in terms of these F1 and F2 scores. They can be a little bit lower for the eponyms, and also that we have good results in terms of postal code. So paralleling some of the results that we've seen in previous, but some differences between the sites. If you look at Manitoba and Ontario, for example, we see some differences with respect to the unit number and also with the eponyms in both the F1 and F2 scores. So just in summary, we found fairly good accuracy with our results. And I think part of the value of the work that we've done is the cross-site complementarity of the data, where we've got in Ontario longer and denser notes. So there's a lot of identifiers, and that may help with the identification of some of the patterns. Whereas in Manitoba, the notes are more concise and more structured. And so there's a difference there in how well does the algorithm work across these different kinds of notes. So, and we get really good performance with some of the high-risk identifiers. We're particularly interested in names and phone numbers and health card numbers and postal codes, that we can do a good job in identifying these. And we have good accuracy with the algorithm for these particular kinds of identifiers. Some of the challenges that we experienced in the site level work that we've done today, to date, is there are differences certainly across sites in the infrastructure that we have available, the support that we have available for doing the deep learning, and challenges just around needing to do a fair amount of harmonization. We've been meeting regularly on this project to ensure that we have consistency in how we're pre-processing the data, in terms of the annotation process. So there was a guidebook for the annotators in each of the sites and the training process as well to ensure that we're doing things as similar as possible across the sites. At the same time, there's been a difference in the timelines and our ability to coordinate across the sites. There's just differences in institutional processes and data access timelines. So as I mentioned with Manitoba and Ontario, that we finished the annotation already and we've done the site-specific model training. Alberta is still in process with that. That's been helpful for Alberta learning with some of the challenges that we've had, but also they're playing catch up in that as we move into the federated learning stage, we'd like to have all of the sites at the same stage. That's not going to be possible. We need to move ahead so that we can finish off the work. All right, so the federated learning process is in progress and getting much closer. It's been a learning one for us about how we can leverage that cross-jurisdictional diversity in terms of the algorithms that we're producing at the site-specific level without any of the sharing of the data. So the notes can be kept local while still benefiting from sharing of the learning process and producing a model that is stronger and more generalizable than what could be produced at any of the individual sites. The work that we have done has been substantial in terms of the processes that we use for privacy preservation. So even though we're not sharing any data, with the large number of model parameters that are being shared, there's still the possibility that someone could work backwards to de-identify, to identify the notes. And so in working with the privacy teams at each of the sites, we want to give assurances that what we're doing is really robust in terms of those processes. So we need to have time to build that buy-in from the privacy staff at each of the sites and talk about the different steps that we move through in terms of privacy preservation. So our processes are close to being finalized. We've also had to define the roles of individuals at each of the sites. So who's receiving the model parameters, for example? There have been a setup of 2 different teams at Ontario in terms of the receipt of the model parameters and then being able to share information back to the Manitoba site. And so we're really grateful for the expertise across Manitoba and Ontario to work these processes out and to transparently document them. And so some of the privacy risks are identified here in terms of taking the model weights and being able to reconstruct, for example, the input text. If there's any documentation leakage, how do we deal with that? And again, part of how we deal with that process is not working with the entire documents themselves, but with these shorter pieces of text. And that's been one way, and just documenting all of the different potential theoretical risks that would exist in a federated learning system. But if we have multiple layers of technical safeguards and procedural safeguards, then that really makes them impracticable for them to occur. And so our teams at both the Manitoba and Ontario sites have worked through these different safeguards and how we're actually going to address them. And this slide just represents some of the activities that are going on there and that we've been documenting.